Good morning, ladies and gentlemen. I am Dr. Ng Seow Ching, Rheumatologist and General Physician from Gleneagles Hospital Penang. Today, I'm going to talk about Introduction to Systemic Lupus Erythematosus, or in short, SLE or lupus. You must be wondering why I'm putting up this picture of a half face of a wolf and a half face of a girl with a purple butterfly beside it. The symbol of the wolf actually comes from the name of the disease. Lupus in the Latin means wolf. It resembles the rash. It looks like a wolf bite on the ancient literature. And then the purple butterfly represents the mala rash on the face of our many lupus warriors. Hence this picture. So these are the content of my talk. I will be introducing what is SLE, what are the signs and symptoms, how do we diagnose SLE, what are the complications of SLE if it is not treated properly, and what should you do if you suspect you have SLE. So what is SLE? This is a chronic autoimmune disease. What do you mean by autoimmune disease? It means that your own immune system accidentally attacks your own tissue, your own healthy tissue, thereby resulting in widespread inflammation and tissue destruction. SLE can affect many organs in our body. For example, your skin, your joint, the brain, the heart, lungs, kidneys, and even your blood vessel. So this is an autoimmune disease in a nutshell, means that your own immune system mistaken your own body tissue as foreigner and then attack your own healthy tissue. So what are the risk factors of getting SLE? 9 out of 10 SLE patients are actually women, and the age of onset can range from 15 to 45 years old. And Asian patients actually were affected more severely compared to patients of other ethnicity. We have famous celebrities that were also affected by SLE, such as Gleneagles. The scar on his face is actually from the discoid rash that he had, which caused scarring of the skin tissue. And last year, we have this Hong Kong actress Zhou Haimei who passed away due to complications from SLE. So what are the causes of SLE? Actually, the SLE can result from a combination of genetic and environmental factors. It appears that people with a genetic predisposition to SLE can be triggered to have the disease if they are being exposed to something in the environment. The triggering factors can be due to sunlight, any infection, or even stress. However, in most cases, the cause of the lupus is actually unknown. So lupus can affect anybody, and they can present with a different array of symptoms. And the symptom can be mild or severe, and some symptoms can even affect the life of the patient. And some patients may even have symptoms that are not listed in this diagram. So the common signs and symptoms that we can see in a patient suspecting of SLE are fever, unrelentless fever, recurrent fever, fatigue, loss of appetite, and loss of weight. These symptoms are actually not specific. It can happen in any diseases as well. Other symptoms are like mala rash, which are quite common in SLE patients, or discoid rash, which can result in scarring of the skin tissue. Some patients may have photosensitivity, which is you may develop rashes after exposure to sunlight, or excessive hair loss, recurrent mouth ulcer, or even multiple joint pain. Some patients may even present acutely with chest pain, shortness of breath, abdominal pain, or some patients may have leg swelling and then on examination found to have protein in their urine. And some patients may also have anemia, that means low white cell count, causing them to have anemic symptoms such as chest pain, shortness of breath, etc. And then some patients may even present severely with headache, confusion, fitting, or even blood clots. Okay, blood clots, if let's say the blood clots are in the legs, patient may present with swelling of the legs, one leg swelling. Or if the blood clot happen in the heart, we may have a heart attack, in the lung, you may have shortness of breath, what we call a pulmonary embolism. And if it is in the brain, you may have a stroke. To add to the confusion and complexity of all this, we have an array of different diseases that can actually present like SLE. So when we examine our patient, we need to examine the patient thoroughly, and also we need to rule out all these diseases. They can have the same sign and symptom like SLE. Diseases that we need to exclude are like infection, such as HIV, hepatitis, Epstein-Barr virus, parvovirus, gonococcus, subacute bacterial endocarditis, that means infection of the inner layer of the heart, and even TB, tuberculosis. Some malignant tumor like your leukemia, lymphoma can also have the similar symptom like SLE. Then not to forget other autoimmune diseases like rheumatoid arthritis that predominantly affect the joint, mixed connective tissue disease, dermatomyositis which affect the skin and also the muscle, causing muscle weakness. Vasculitis means inflammation of the blood vessel. Scleroderma, patient can have thickening of the skin, but they may also have joint pain, etc. Sjogren's syndrome, some patients may present with dry eye or dry mouth, but they may also have joint pain and also blood cell abnormalities. And even inflammation of the thyroid can also present like an SLE. And then we also have these mimickers of rashes, such as rosacea and also fungal infection, that all these we need to investigate and rule out in patients suspected of having SLE. So how do we diagnose SLE? First, the rheumatologist have to take a very detailed history. And then we evaluate your organ system systematically. And it is important also to take a family history. Then, of course, we examine your every organ system in our consultation with you. These are investigations that we do in aiding us to reach a diagnosis, like routine blood tests like your full blood count, where we are specifically looking for low white cell count, low red cell count, low platelet. Renal profile to see if your kidneys are being involved. Liver function test to see if your liver is being involved. And of course, we need to check HIV, hepatitis B and C to exclude any infection. ESR is an inflammatory marker that we do for our patient. If it is high, it signifies that you may have an inflammatory disease going on. Urine FEME is mainly checking your urine to see whether got protein or blood in your urine or not. And then, of course, we have specific antibody that we do specifically for SLE, such as ANA, anti-dsDNA, ENA, which also help us to rule out other autoimmune diseases, C3, C4, Coombs test, and anti-phospholipid antibody. These anti-phospholipid antibody are associated with SLE and can cause blood clots. And depends on your symptom, we may order additional tests such as chest X-ray if you have shortness of breath, to look at the heart and the lung to see whether is there any fluid in your lungs or not. And echocardiography if we suspect heart involvement. And in certain patients with kidney or skin involvement, we will also do a biopsy of the kidney to see the severity of the kidney involvement, and so that it can help us in giving the correct treatment to our patient. So does ANA positive means that I have SLE? The answer is no. Positive SLE is not enough to diagnose SLE. Okay, SLE, the diagnosis of SLE incorporate the combination of clinical features, blood test, urine test, imaging study, and biopsy. SLE is a very complex disease with different symptoms, and every SLE patient actually present differently. And the diagnostic process is actually very challenging for us. We need to have a high sense of acuity for us to differentiate SLE from other diseases and also to stage your disease. So ANA positive doesn't mean SLE. The ANA test is sensitive but not specific. ANA positivity can be present in about 5% of normal population, but in a very low titer, like 1 in 80. Usually ANA 1 in 80 is not important, and usually patient does not have any symptom. And ANA can also be present in other conditions as well, such as drug-induced, and the positivity of ANA actually increases in patients more than 65 years old. Other autoimmune diseases that I mentioned before can also have positive ANA. Some viruses, bacteria, tumor, and even pregnancy can cause ANA positivity. Therefore, screening for SLE with ANA is actually not effective. We do not routinely screen for SLE in our patient. We only do ANA if we suspect patient to have SLE or other autoimmune diseases. For example, like in the US, 20 million people can be tested positive for ANA, but only 1 to 2% have SLE. Therefore, we do not screen patients with ANA for SLE. So the ANA result need to be interpreted in the context of individual patient and also in combination with other test results. So these are the American and European classification criteria for SLE that we use to help us in the diagnosis of SLE. It incorporates the clinical symptom and also your immunologic domains, your antibody. Sound confusing, but leave it to us to help you diagnose. So what are the complications of SLE if it is not treated properly? You can develop pericarditis, which is the inflammation of the lining outside your heart, or myocarditis, which is the inflammation of the muscle of the heart. Some patients may present with shortness of breath, and then when we check, there are fluid accumulation in the lining of the lungs, what we call a pleural effusion. Some patients may even cough up blood or pinkish sputum, what we call a diffuse alveolar hemorrhage, means bleeding in your lungs. Okay, these are severe complications. Some patients that have abdominal pain, when we check, patient may have mesenteric artery ischemia, means the blood supply to the gut are being affected, cut off. So patients have no blood supply to the gut, that's why patient is having abdominal pain. Or patient may have rapidly progressive glomerulonephritis, means very rapidly progressive inflammation of the kidney, and this may lead to kidney failure and even dialysis. Some patients can present with lupus cerebritis, means inflammation of the brain, causing patient to have fitting, stroke, or confusion, memory impairment as well. And of course, not to forget antiphospholipid syndrome, which are blood clots which can affect the brain, the lungs, the heart, or the legs. How about complication in SLE patient, pregnant SLE patient? They may have miscarriage, hypertension in pregnancy, or even premature labor if the SLE is not controlled when they are pregnant. So what do you do if you suspect yourself to have SLE? Most important thing is to get yourself checked up by a professional healthcare personnel, such as your family doctor. The best is to straightaway consult a rheumatologist. And then when you see the doctor, provide as much detail about your symptom as possible. And also, important thing is your family history. And then expect that the patient will do a thorough physical examination on you, and you must understand the diagnostic process. That means we will do the blood test, imaging study, etc., urine test based on your symptoms. And then always have an open communication with your healthcare professional. And you can seek help with your family, friends, or with our SLE Society, Penang SLE Society, or other SLE Society throughout Malaysia. So a bit about the natural history of SLE. The SLE natural history, it is not always flat line. It can be bad when patients have a lot of symptoms when the disease are active, or it can be quiet where you have no symptoms at all. So the aim of treatment for SLE is to reduce the activity of the disease and to reduce the complications so it does not damage your organ any further, and to reduce the side effects of the medication and to increase and improve your quality of life. Although there is no cure for SLE, however, having a correct plan can help you to lead a normal lifestyle like a normal people, especially if it is diagnosed early and treated early. So can SLE patient get pregnant? Possible. Remember to discuss with your rheumatologist at least 3 to 6 months earlier before you are planning a pregnancy, because the rheumatologist need to assess you to determine whether you are suitable for pregnancy or not. If your disease are very active or you are on a lot of medicine with high doses, most likely you cannot get pregnant straight away. We need to control your diseases first so that you do not have complications during your pregnancy. And of course, when you are stable, we can plan for your pregnancy, and also we can even modify some of your medication, your SLE medication, to be suitable for you to take during pregnancy and even breastfeeding. We usually work hand in hand with our obstetrician in monitoring our SLE patient very frequently to ensure that our SLE patient have a safe pregnancy and delivery and a healthy baby. So this is my last slide. These are take-home messages. Early diagnosis and correct diagnosis can lead to effective and correct treatment and hence lead to control of your disease and a normal lifestyle. With that, I thank you.
Okay, so thank you so much, Dr. Ng, for such a thorough introduction to what is SLE, the history, and the set of diagnosis, set of criteria and such. So I'd like to ask the crowd if you have any questions for Dr. Ng. So we are in our Q&A session if you have any questions regarding SLE.
Hi, can I speak in Malay? Yes. Okay. So, I nak tahu, kalau you dah ada SLE, memang you akan experience all of that ke? Macam rashes, all the symptom lah. Maksudnya macam currently, I'm already taking medication for SLE for 2 years already. So far I never experienced like rashes other than joint pain and rambut gugur. Other than that, I tak experience lah. Adakah walaupun dengan ambil medication, I still akan experience all of other symptom? Thank you.
Okay. First of all, not every patient will experience the classical symptom of SLE. Bukan semua orang akan experience macam rashes. Some no rashes at all. Some no joint pain. And then even when you are taking medicine, there is usually if you take medicine properly and follow up properly, you shouldn't have an active disease. Means you shouldn't have a flare. Maksudnya penyakit, kalau you ambil ubat betul-betul, ikut pemeriksaan doktor betul-betul, tidak sepatutnya ada active disease, ada flare lah. Tapi sesetengah pesakit, kadang-kadang dia ada jangkitan kuman yang teruk, atau dia sangat stres ke apa, or ada hormone changes ke apa, dia boleh tiba-tiba SLE-nya become active. And then SLE symptom bukan semua orang akan macam textbook perlu ada symptom macam ni. Semua orang present differently. That's why it's a very diverse disease. Okay, some patient when they first diagnosed, okay maybe tak ada rash, tapi selepas tu bila disease-nya jadi aktif, tiba-tiba keluar rash pun ada. Ada yang mungkin langsung tak ada rash. Ada yang come with joint pain, no other symptom, but when we check, kenapa sel darah putih rendah, sel darah merah rendah semua macam tu, tapi dia tak ada symptom lain. So it's very different for different individuals. They react very differently. Okay, this is a very simple slide to help you understand what is it lah. If you have a doubt whether you have SLE or not, or whether you already have SLE, whether you are having a flare or not, please do not hesitate to consult your rheumatologist. Okay, we will examine you thoroughly and also do the relevant tests to aid in your diagnosis and help to manage your disease.